Well, good morning everyone. Unfortunately, I can't be with you in person today, but I wanted again to provide a message to this important conference. I'm recording this on the lands of the Ngunnawal people, and I'll start by paying my respects to their elders past, present and emerging. I also want to acknowledge Australian Sickle Cell Advocacy, your chair Dr. Nari Elwood and your Executive Director Agnes Software for your outstanding commitment over the past 4 years. You've raised awareness of this disease at all levels, in the community, in the health and research professions and here in government. Because while it is still reasonably rare in Australia, this disease is increasingly prevalent as our multicultural society continues to grow. We know how important early diagnosis and intervention in those early moments of life can make a huge difference for a number of rare diseases. One issue you've strongly advocated for is health equity, making screening for sickle cell disease available for all newborn babies. Everyone wants their child to have the best chance in life. A small percentage of babies will have a rare condition that can have severe or even fatal outcomes. Australia once led the world with our Australian newborn blood spot screening programs. In recent times though, these programs haven't delivered consistently for all Australians. We know there are differences between different jurisdictions on what screening tests are available. And this is an area that we're really focused on. We want screening to be available to all Australian babies for the same conditions, no matter where they live. I want all babies across our country to receive a diagnosis in those crucial first moments of life, when it matters most and when we can have the biggest impact. The Australian Government will put an end to this disparity by ensuring that all newborns get all of the recommended screening tests, no matter where they are born. This is an election commitment that we're already implementing. We've announced more than $38 million over 4 years to help deliver more consistent and equitable newborn screening programs. I know this won't be a simple process and it won't happen overnight. I've raised this already with the states and territories and my department is already working on it. I know ASCA has been invited to take part in this process and I'm sure that your input will be invaluable. Consultation has commenced, including with culturally and linguistically diverse groups and First Nations people. Details for further consultation will be available shortly. And today we're focusing on sickle cell disease. ASCA applied to have the test for sickle cell included in the NBS in late 2020, and I can advise that a rapid evidence review has been completed. The application is now undergoing a health technology assessment, and the Medical Services Advisory Committee will provide advice in the middle of next year. I know it can never be soon enough, but this is progressing. With any screening program, the evidence has to be carefully considered. And it's not just about the lab tests. It's important to ensure the follow-up is there in terms of diagnosis, communication with families, counselling, and a positive medical pathway for the child and the family. It means access to specialty services like paediatric haematology, immunology, physiotherapy, cardiography, social services, and many, many others. I'm really keen to work with you, the rare disease sector, the medical profession, and with state and territory governments to once again have a world-leading newborn blood spot screening program here in Australia. Most importantly, to make sure that no family misses out on the medical technology which could give their babies the very best chance in life. Thank you, and I wish you all the very best for your conference.